nothing, I will not leave anything to your imagination. I will cover everything here, and I'm so happy to see all of you excited. And I'm the basic rule of life is that people who are excited to learn, they will always do better than people who are not excited to learn. Enthusiasm chahiye. We all need to be enthusiastic about learning. If you are enthusiastic about learning, we'll do better. Okay. So let us start with the today's topic. Okay. Everybody on your marks. Okay, so today is the second class for the children who have missed the first class. Better, I think you might have missed it. We already did one class on 29th. So if you have missed it, the recorded lecture is already available to you. Please see that. That is a CT scan. Okay, the first class was on CT scan. So what I'll do here is I will straight away, okay, share my screen and I will open a okay, I will open the take note and the OneNote sheet. Okay, everybody. Yes, so I have all of you with me now. Okay, so let us write the first line of the day. Okay, I'm writing the first line of the day. Don't worry if anybody is coming late, don't worry. First line of the day is MRI. So just like in my first class I started with the word CT scan, today I am starting with the word MRI. Okay, everybody write down MRI. So MRI stands for magnetic resonance imaging. Okay, MRI stands for magnetic resonance imaging. That means it has to do something with the magnetic field. Now remember, okay, everybody, CT scan had radiation exposure. Remember, we discussed this in the first class. MRI has no radiation exposure because it is based on magnetism. And that is why whenever you get a question here, remember MRI is safe in pregnancy. Everybody clear? Is MRI safe in pregnancy? Yes. Okay. Everybody understands? Okay. So this is the first question I wanted you to remember. Now, second question is, what does an MRI machine look like and how does it work? I will first of all tell you the basic concepts behind it because we have to understand things. We don't want to mug up things. So please see with me, MRI machine is a magnet. MRI machine is a large closed magnet. Okay. This magnet has a magnetic field strength of 1.5 Tesla. Okay, the U हाँ जी, हाँ जी बच्चों, just wait, because I think we are having a unstable internet at home, but we will be able to do it. Don't worry. Okay, don't worry. Okay. Okay, so I think we should be able to get back. I have just connected with my phone's internet. By the time I'm restarting the modem to get it back, I will update you once the internet is better. Okay, so just bear with me for the internet speed right now, and once the internet is better, I will be able to do it. है ना? I'm just connecting with my phone's hotspot. Okay, now let's go back again. Okay, let's start again. There will be a little bit of a challenge right now, but we will be able to do it. Okay, so today we discussed so far that MRI machine is a magnet with a magnetic field strength of 1.5 Tesla routinely. MRI machine is a magnet with a magnetic field strength of 1.5 Tesla routinely. And this is where the patient has to lie down. Okay, this is where the patient has to lie down. So I hope you understand that suppose somebody has claustrophobia, it will be difficult to get a MRI done. Do you see the position of the patient now? Do you see the position of the patient? The patient is inside the MRI machine. So in a MRI machine, it's a closed machine, it's a closed magnet, and it is difficult to do MRI of claustrophobic patients. It is difficult to do MRI of claustrophobic patients. Now, question number one is, let's see if how many of you can answer. How are you able to see the parts of the body in a MRI? What is it that is present in our body, which is the target for MRI machine? Please remember, please listen to me. MRI machine is a magnet, and in a human body, we have magnets called as hydrogen ions. So MRI machine is based on presence of hydrogen ions or protons in the human body. So what are hydrogen ions? Hydrogen ions are tiny magnets that are present in our body. Okay, listen to me, everybody. Listen to me. Now I'm telling you today that I have thousands and thousands of magnets inside my body, which are called as hydrogen ions. Okay, that means I should have magnetic field. But in reality, I do not have any magnetic field inside me because all of them are randomly aligned. Are you aware of this fact from school? That hydrogen ions in our body are randomly aligned. Okay. Okay. So they are randomly aligned. So we have net magnetic field in our body is zero. So you don't have any magnetic field in your body. Hydrogen ions are all randomly aligned. Okay. Now, when I go inside the MRI machine, once you go inside the MRI machine, the hydrogen ions get aligned along the axis of the magnetism vector. Do you remember? So remember, in our body, we have tiny magnets called as hydrogen ions. So when I go inside the MRI machine, these hydrogen ions are aligned along the axis of the magnetism vector. Okay, I'll just shift the internet here just to. Everybody is able to see. So so the lag was because of the internet speed. So I shifted the internet back to the Wi-Fi. So now please understand with me. So whenever we go inside the MRI machine, the hydrogen ions will be aligned along the axis of the magnetism. So we have to write it in a notebook right now. So now what we do is whatever body part, okay, everybody listen to me, whatever body part we want to see, okay, whatever body part we want to see, on that part we apply a radio frequency pulse. So we will call it as RF pulse. Okay. Oh, there was a little lag in between because I shifted the internets, but please see with me and understand. So whatever part we want to see in our body, in that part we apply a radio frequency pulse. Now this radio frequency pulse is a short-lived magnetic pulse. So whenever I apply a RF pulse to the part of the body, that area gets excited and hydrogen ions, they get excited into new direction. Okay, the hydrogen ions get excited and they start going into a new axis. Now if I switch off the RF pulse, what will happen? Everybody think of it and answer. If I switch off the RF pulse, the hydrogen ions will relax and get back to the baseline. Everybody understands this? Are you able to see this much? Okay, so I'm summarizing again. So what we have done is we have now subjected the patient to a changing magnetic field. So first he is inside a MRI machine. So the area that we want to see, please see with me, the area that I want to see in that part of your body, we will apply a radio frequency pulse. Then we will switch it off. So when we apply a radio frequency pulse, the hydrogen ions get excited. And when you switch it off, the hydrogen ions relax and get back to the baseline. Everybody understands? Now, let's understand how this works. Now, let's go to the atomic level now. Suppose this is a hydrogen ion, okay? And I have applied a radio frequency pulse. I have applied a short-lived radio frequency pulse, a short duration RF pulse. So whenever, I'm repeating everything, beta, listen to me. So whenever we apply a short-lived RF pulse, the hydrogen ions, they get excited and they go to a new position. The hydrogen ions get excited and they go to a new position. Everybody understands? Okay. Now, if I switch off the RF pulse, listen to me. If I switch off the RF pulse, what will happen to the hydrogen ions? Anybody? If I switch off the RF pulse, the hydrogen ions will now relax and come back to its original position. If I switch off the RF pulse, the hydrogen ions will relax and come back to the original position. Everybody understands? But how long will it take for them to come back to the original position? So this process that I've just described to you in magnetic physics is called as longitudinal relaxation. And time taken for hydrogen ions to show longitudinal relaxation is called as T1. Okay, this is very important. Okay, this is very, very important. Otherwise, you will have to mug it all up. Please understand the basic physics. Then I'll go to clinics. Don't worry. Okay, are you clear or not? So when I'm outside the MRI machine, my hydrogen ions are randomly aligned. When I go into the MRI machine, they get aligned along the axis of the MRI machine. Then I disturbed by RF pulse and I switch it off. Okay, listen to me. Listen to me. So whenever we apply, or everybody listen to me, whenever we apply a RF pulse, the hydrogen ions, they jump to a new position. When I switch it off, the hydrogen ions come back to the original position. This is called as longitudinal relaxation. It happens in a time constant called as T1. Okay. Now, second thing is, now suppose this is a hydrogen ion. Hydrogen ions in our body are not static. They are actually spinning around their own axis. So now listen to me. But I'm writing everything down, beta, Soumya. Okay, I'm writing everything down. So, beta, you do not become a stenographer. Whatever I am writing, this is what you need to write. Listen to me. Listen to the teacher, beta, please. So, whenever the hydrogen ions, listen to me, beta, are in the baseline, they are also spinning along their axis. So if I apply a long duration RF pulse, not only the hydrogen ions will shift their position, they will also change their spinning axis. Okay, so when we apply a long duration RF pulse, the hydrogen ions, they change their spinning axis. Okay, this is called, so now when you switch off the RF pulse, the hydrogen ions will recover the spinning axis. This is called as transverse relaxation. In magnetic physics, we call it transverse relaxation, and it happens in a time t2. Okay, please listen to me, beta. Please listen to me. Okay, listen to me that every tissue, every substance in our body undergoes in a changing magnetic field two types of relaxation. Okay, I will not bore you with too much physics, but listen to me this much. Okay, the every tissue, hydrogen ion in our every tissue undergoes two types of relaxation in a changing magnetic field in an MRI machine. One is called as longitudinal relaxation, one is called as transverse relaxation. Longitudinal relaxation happens in the time t1, which is a constant for every tissue. That means each tissue will have its own t1 relaxation time, its own t2 relaxation time. Now try and understand. This is something that you will hear a lot when you look at your medicine and surgery books. So MRI images which are based on T1 relaxation time are called as T1 weighted image. MRI images which are dependent on T2 relaxation time are called as T2 weighted image. Okay, I'm writing the spelling also better, don't worry. Weighted image. Okay, so radiology has a little bit of physics involved into it. Okay, so gradually I will introduce you to the radiology physics also. So MRI has to be based on some magnetic properties, beta. So have you ever wondered what magnetic property are we looking at in MRI machines? We are looking at the behavior of the hydrogen ions. Whenever we are changing the magnetic field, the hydrogen ions will change their position as well as their spinning axis. So when we switch off the change, the hydrogen ions recover their position in time t1 and they recover their spin in time t2. Everybody clear? Okay. Are you able to understand this? Are you able to understand this? Okay. It's difficult, bache, hai na? Especially for doctors who are, not interested in physics. But if you are interested in physics, you will find it very, very interesting that how beautifully we utilize those physics principle in medicine here. Okay. Are you clear? Now listen to me. Okay, listen to me, beta. Listen to me. Okay, okay. Now, whenever we apply a RF pulse is defined by two properties: TE, TR. TE stands for echo time. TR stands for repetition time. RF matlab radio frequency pulse, beta. TR stands for repetition time. Okay, I will just after this I will finish the physics beta, but listen to me once. Okay, radio frequency pulse, better listen to me. Even PGs find it difficult to understand. Okay, so don't blame yourself, listen to me. But okay, a radio frequency pulse that we apply in MRI machine is defined by two parameters: TE, which is echo time, TR, which is repetition time. If we have a short TE and short TR, that means you are rapidly applying short duration RF pulse on the human body like this. Tick, tick, tick. You must have heard those noises when you went into the MRI machine once, or you might have heard of somebody else getting an MRI done in your family. So whenever MRI is being done, you hear noises like this. Tick, tick, tick. So if you apply short duration RF pulses at short repetition time, the resultant image is primarily based on longitudinal relaxation. We call it T1 weighted image. If the echo time and repetition time both are long, the image will be predominantly based on transverse relaxation, which is called as T2 weighted image. Okay, everybody follows? Everybody follows? Okay. It's little difficult to understand, but let's try beta, let's try, है ना बच्चे देखिए I told you that it is not that I will tell you all the easy things. I will tell you the truth that you need to know. I will try to make my effort best to make you understand, but I will not tell you only the easy things. I want you to understand what is happening in the body. Okay. So in MRI, now I'm going to come and tell you the message beta. Okay. MRI has two kind of images, T1 weighted, T2 weighted, because every tissue in a changing magnetic field undergoes two type of relaxations: longitudinal relaxation, transverse relaxation. And it all depends on how long am I applying the radio frequency pulse, which is the echo time, and how at what interval I am repeating the RF pulse, that is the repetition time. Okay, everybody's okay, everybody okay, little bit okay. Now, so now I'm going to summarize it beta. Okay, I'm going to summarize it beta, don't worry. Okay, I'm summarizing it because so MRI is different from CT. If you remember, now I'll show you the physics difference that you may not know and nobody will tell you also, but I want you to understand. CT scan was dependent on attenuation of X-ray beam, which is dependent on the electron density of the tissue. On the other hand, MRI is dependent on hydrogen ions and how long do the hydrogen ions take to show longitudinal and transverse relaxation. Okay, is that understandable? Is that understandable? So MRI is not based on attenuation, it has no X-rays. It is based on how the magnetic field that we are applying interacts with the hydrogen ions in my body. Everybody okay? TE stands for echo time, TR stands for repetition time. Okay, I'll just show that slide again for the children who could not follow. Are you okay? So TE was the echo time, TR was the repetition time. If both of them are short, you will get a T1 weighted image. If both of them are long, you will get a T2 weighted image. Now let's quickly go to clinical part now. Okay, now see. So this is the physics behind the MRI machine. Okay. So because what I wanted you to do is, because I see a lot of children, they will never understand in their life that how MRI is working. I wanted to see and make sure that you understand. Now what happens is, because different tissues will have different 3D lattice structure. So I hope you can understand. In our body is made up of carbon, and you also have hydrogen ions. So each part of our body will have a different 3D lattice structure of carbon. So the hydrogen ion relaxation time will be different for different tissues. I hope you can agree. Bone will have a different property in MRI as compared to fat or brain tissue, because it is not just hydrogen that we have in our body. In our body, we also have a carbon lattice. Are you able to understand this? So that is why different tissue will exhibit different T1 and T2 relaxation times. And that is why their appearance on MRI will be different from one another. Everybody follows? Everybody follows? Okay. Now see. Now listen to me and answer. Okay. So let's see an answer. Let's see if you can answer. Okay. Okay. Listen to me and answer, beta. Hana? Listen to me and answer. So what we need to know is, clinically, all we need to know is that in MRI, we have two type of basic MRI images called as T1 weighted image and T2 weighted image. Okay. In MRI, listen to me, beta, listen to me. It's morning only. It's okay. It's early in the morning. Don't worry. You're relaxed. Okay. In MRI, there are two type of images: T1 weighted, T2 weighted. So they will always ask you in the exam, and you need to know that clinically also, what is the MRI appearance of CSF? What is the MRI appearance of CSF? Okay. So Rahil, I'm repeating for you, beta. T1 and T2 were intrinsic properties of each tissue based on their carbon lattice structure, But remember, echo and repetition time are properties of the RF pulse that we are applying. So if we apply short duration radio frequency pulses at short intervals, the resultant image is T1 weighted. If I apply a long radio frequency pulse with a long gap in between, so then we see longitudinal, then we see transverse relaxation and we have a T2 weighted image. Okay. Okay, everybody understands. Now, question number 1 is, okay, so now we are, now बच्चे जो भी physics से डर रहे हैं बच्चे घबराएंगे नहीं. Now we are going away from physics. Now I will tabulate the basic appearances that we need to know before we look at an MRI images. CSF on MRI appears dark on T1 weighted image, white on T2 weighted image. Can I repeat? Okay. CSF on MRI appears dark on T1 weighted image, white on T2 weighted image. But the problem is that we have a complex language of speaking. Okay. So in radiology, we will use a word like this. CSF appears hypo-intense on T1 weighted image, hyper-intense on T2 weighted image. I can even say low signal on T1 weighted, high signal on T2 weighted. Everybody clear? Now see, if you notice, in CT scan, my language was hypodense, hyperdense. Okay, in CT we use the word dense. In MRI, we use the word intense. So don't get panic, all the bachas. So this is the language of MRI. Okay, there is a language of medicine that we need to know. If it is dark, I will say hypo intense. Okay. If it is white, I will say hyper intense. Okay, beta. Everybody clear? Okay. So whenever we describe anything dark in MRI, I can use hypo intense or I can use the word low signal. Everybody understands. So what is the MRI appearance of fat? Fat on MRI is white on T1 and slightly less white on T2. Fat on MRI is white on T1 weighted image, less white on T2 weighted image. It is never dark. Okay. So in last to last year, 2019, in NEET PG exam, they asked, which substance in our body is hyper intense on both T1 and T2 weighted image? Which substance in our body is hyper intense? Hyper intense means white on both T1 and T2 weighted image. The answer has to be fat. Okay. So this is the terminology of MRI. This is how the language of MRI is. Okay. So what happens is, as a child, as a kid, you don't know the language, so you find it tough. So that's why I'm explaining the language to you. Which substance in human body is hyper intense on both T1 and T2 weighted image? The answer is fat. Okay. Second thing I want you to remember is, okay, everybody listen to me. Very, very important question. Cortical bone and calcium are dark on both T1 and T2 weighted image. Cortical bone, and I will show you the beta. If you don't know the appearance, you will not be able to see the images. So please listen to me first. Then we will shift and look at the images and understand how to look at it clinically. But please see with me an answer. Cortical bone and calcium on MRI, they appear dark on both T1 and T2 weighted image because of their magnetic property. That is the idea. Okay, everybody understands? Okay. Now look at the table in front of you. Now I'm drawing a table in front of you. You need to tell me, looking at this table, and tell me what is written in front of you. Okay. I will make a table in front of you. You need to tell me what is written in that table for you. Fat is white on T1, less white on T2 weighted image, dark on both. What is written? What is written in front of you? I have written, bache, I have written the difference between CT and MRI. Do you recall from my last class? On a CT scan, the cortex of the bone and calcium were appearing white. On a CT scan, the cortical bone and calcium were white. On MRI, they appear dark. Fat was dark on MRI because it had a Hounsfield value of -100, while fat is white on MRI. So if you know this, bache, listen to me, okay? If you know this, this is more than enough to look at an image and tell, am I looking at CT or am I looking at MRI? Beta, do you understand that when whatever I am teaching, in the real exam, you will be worried more about कि सर ये CT दिख रहा है कि MRI दिख रहा है ना? So we need to understand. देखो बच्चे बड़ी बात अलग है, लेकिन आप तो बच्चे पेपर में CT MRI नहीं बता पाओगे. So how will you look at it? If the calcium and the cortex of the bone are dark and the fat is white, we are probably looking at a MRI. Everybody understands? This is opposite to what we saw in CT. Everybody understands? Very good. So this is very important for you, beta. Now, but there are some more things that we need to remember. Things like tendons, ligament, everything I will show you visually also, beta. I'm just tabulating so that it becomes easy. Tendon, ligament, and meniscus. Okay, tendon, ligament, and meniscus. The common thing between them is all of them are fibrous tissue. So tendon, ligament, and menisci are also dark on both T1 and T2 weighted image. If they ask you, beta, okay, listen to me. What is the normal appearance of any tendon or ligament on MRI? It is fibrous. It will be dark on both T1 and T2 weighted image. But in addition to this, there are some confusing things. Air is also dark on both T1 and T2 weighted image. If you have a chronic hemorrhage leading to hemosiderin production, even that will appear dark on both T1 and T2 weighted image. If there is blood flowing in any blood vessel, that blood vessel will appear dark on both T1 and T2 weighted image. This is called as flow void. This is called as flow void. Okay, I will explain many things to you once you understand this. Okay, I am repeating, beta. I am repeating everything and then we will understand. Okay, beta, wait, Ishita and everybody, wait. I will show you the visuals and we'll understand. But first, we need to know the basics. If we don't have the basics, the images and the clinics will not make sense. Okay, we need to know the basics. Fibrous structures like tendon and ligament are dark on MRI. Air is also always dark on MRI. Hemosiderin will be dark on MRI. Flowing blood will be dark on MRI. Okay. Now, once you are clear with this, beta, once you are clear, okay, I will explain some things that you will learn in medicine and ENT and different subjects. Okay. First, let us understand something that you learned in ENT. In ENT, so I want to see a little bit of ENT radiology, beta. Listen to me. In ENT, did they tell you about glomus tumor? In ENT, did they tell you about glomus tumor? Yes. Listen to me, beta. Listen, I'm repeating, beta. I said anything which has blood flowing inside, if there is a blood vessel with a flowing blood inside, it cannot produce any signal. It will only remain dark. So we say signal void. Okay, or we say flow void. Flow ke karan khalipan. Void means empty, black. So any blood vessel where you have flowing blood in MRI appears dark. It is called as flow void. Okay, listen to me. So in ENT, bache, listen to me. Any flow will lead to flow void. Any flow. Okay. Now listen to me, beta. In ENT, they talked about a glomus tumor. Do you remember glomus jugulare? Or did they say glomus tympanicum, all those things? So the glomus tumors are very vascular. Now suppose this is a glomus tumor. it is very vascular. Listen to me. If it is very vascular, it should have a lot of blood vessels. They should have a lot of blood vessels with flowing blood. But the flowing blood on MRI appears dark. Flowing blood on MRI is always dark. So you will see dark, 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 blood vessel, dark, 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 dark. And that is why whenever the foreign people saw this, they saw, oh, maybe it is some black, black dots, and they call it salt and pepper appearance on MRI. Okay, so I hope this helps you to understand what you learned in your ENT also. That, in ENT they talked about glomus tumor, and they said glomus tumor on MRI will have salt and pepper appearance. Why? Because of vascularity. Because the blood vessels which have flowing blood, they show flow void. Is that okay to understand? Okay. Now let's understand it further. Now, some of you are getting confused between CT and MRI, but the CT ka aadhar, the basis of CT was different. CT was based on X-rays and how the tissue is stopping the X-ray beam. MRI has nothing to do with X-ray. It is based on how hydrogen ions relax in a changing magnetic field in one particular tissue. Okay, that is the reason. Okay, now let's understand one more concept. This concept is slightly tough to understand. But once you understand, you will be always able to answer this question with me. Let's see if you can answer. If you have brain hemorrhage, I can divide it into acute stage. Acute brain hemorrhage is defined as less than 48 hours. Okay. Then I can say subacute. 3 to 7 days, I will call it early subacute. 7 to 14 days brain hemorrhage, I will call it late subacute. Then we will have chronic stage, which is more than 14 days in duration. Okay. Glomus will have multiple blood vessels, and those blood vessels, now beta, I'm sure some of you are unable to visualize. Beta dekho, if these are the blood vessels, if I take a cross section, so the vessels, when you cut them, they look like dot, 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 dot. You understand? Do you understand this or not? If you cut a blood vessel like this, it will look like a dot. Okay, children? Yes. So now if I divide brain hemorrhage into, listen to me everybody, into acute, subacute and chronic. Acute is less than 48 hours, subacute, early subacute is 3 to 7 days, late subacute 7 to 14 days, chronic more than 14 days. Now listen to me. Acute brain hemorrhage has deoxyhemoglobin. Okay, so in your blood you have oxygenated hemoglobin. When the blood comes out of a blood vessel into the brain parenchyma, it has deoxyhemoglobin. Okay. After 48 hours, this deoxyhemoglobin converts into methemoglobin. After 48 hours, it converts into methemoglobin. Okay. After 7 days, the RBC membranes lyse. When the RBC membranes lyse, they destroy, the RBC membranes destroy. Methemoglobin comes out and it becomes spread out. It is called as extracellular methemoglobin. And after 14 days, it is converted into hemosiderin. This is how a blood clot degrades. Okay, listen to me, beta. Okay, listen to me. This is how a blood clot degrades. Some of you are thinking too fast. Beta, listen to me. But a hemangioma, you are saying hemangioma will have slow flow. I'll show you hemangioma later on when I talk about other things. Hemangioma will have slow flow. So that is not leading to flow void because the blood flow is very, very slow there. It is a very sluggish vascular malformation. Okay, listen to me and understand. So acute brain hemorrhage has deoxyhemoglobin. After 48 hours, it converts into methemoglobin. After 7 days, the RBC membranes lyse and the methemoglobin spreads. After 14 days, it becomes hemosiderin. Okay, now understand everybody. Listen to me, everybody. I'm trying to answer a question. Deoxyhemoglobin has no special magnetic property. Deoxyhemoglobin has no special magnetic property. Now, what do you think? Tell me, children, on what property do you think the magnetic property of any molecule depends on? Magnetic property of any molecule depends on number of unpaired electrons in the outer shell. Do you remember this from school? Did they teach you this in school? Diamagnetic, paramagnetic, like this. So, जिस outer shell के अंदर है ना, ओके, लिसन टू मी बेटा, आउटर शेल में कितने अनपेयर्ड इलेक्ट्रॉन है, दैट इज द बेसिस ऑफ हाउ मैग्नेटिक दैट मॉलिक्यूल विल बी. Deoxyhemoglobin does not have unpaired electrons. So what happens is, on MRI it has no special appearance. On MRI it has no special appearance. Hence, for acute brain hemorrhage, non-contrast CT is considered the investigation of choice because MRI often misses it. It is unable to tell this is hemorrhage or some other disease. Okay, are you clear with this or not? Okay, this is very important question to answer. Okay, very, very important question to answer. Okay, any molecule, the magnetic property depends on the number of unpaired electrons in the outermost shell. Deoxyhemoglobin does not have them, it is diamagnetic. So acute hemorrhage is always better seen on a CT than MRI. Are you clear? So you will see this question being asked multiple times in your exam. Okay, so I am, because I am only telling you, listen to me beta, I will come back to this table. In your exam they will say patient has a suspected acute brain hemorrhage. What will you do? CT scan or MRI? You will do a non-contrast CT. What investigation will you do in a patient with acute head injury, whenever you have to look at the brain hemorrhages in head injury? Again, NCCT, NCCT. Are you clear or not? But only difference in my teaching and your learning is, I am telling you fact plus thinking process behind it. Okay? And you will appreciate any fact which has a reasoning behind it becomes more easy to understand. Okay, I will talk about it, but gradually, wait, don't run faster than I am running. I'm actually going very, at a good pace. Listen to what I'm saying. Okay, but try and listen and absorb what the teachers are saying. If you keep thinking, that means you have too much noise in your brain. Please make your brain a little silent and listen to me. Okay, bache? So this is the reason why in acute brain hemorrhage we always do a CT scan. Acute head injury we always do a CT, not MRI. Okay, this is the rationale behind it. Now we come back to this. Now understand, deoxyhemoglobin is diamagnetic. It has no specific magnetic properties, so we prefer CT. But this is not true. This is not true about methemoglobin, extracellular methemoglobin, and hemosiderin. Methemoglobin, extracellular methemoglobin, hemosiderin, they all have different magnetic properties. So they have a varied appearance because of their magnetic properties. So if I now write T1 weighted image, T2 weighted image, early subacute hematoma appears bright on T1, dark on T2. Late subacute hematoma is bright on both T1 and T2. Hemosiderin is dark on both T1 and T2 weighted image. Okay. Okay. Everybody understands? Okay. So listen to me, bache. Listen to me. So brain hemorrhage has a very complicated appearance on MRI because at different stages the hemoglobin degrades into different products and they have their own different magnetic properties. So in early subacute stage, brain hemorrhage appears bright on T1, dark on T2. Late subacute stage, it becomes bright on both T1 and T2. Chronic hemorrhage because of hemosiderin appears dark on both T1 and T2 weighted image. And you can understand now And let's see if you can answer my question. What do you think is easier for my eye to see? What is easier for my eye to see, bright or dark? Okay, tell me. So bright is easier to see as compared to dark. Okay, so that is why for subacute hemorrhage, MRI, the routine MRI is preferred. Especially we look at the T1 weighted image. In chronic stage, we need to do a special kind of MRI sequence, which is called as susceptibility weighted MRI, SWI. Okay, so it's very difficult to understand at first go. In a routine T1 and T2 weighted MRI, we are easily able to see the subacute hemorrhage, especially on a T1 weighted image, because it is bright on T1 always. But hemosiderin is difficult to see on a routine T1, T2 image. So we do a special kind of MRI technique called as susceptibility weighted imaging. Okay. So now answer, which special MRI sequence is used in brain hemorrhage to look for hemosiderin deposits? Susceptibility weighted images. In your exams, they will write SWI. Okay, I will show you all this. Okay, I will show you all this. But before we see anything, we need to understand the thinking process. Otherwise, you will not be able to see. Okay, so wait, everybody wait. When I show you this image, I will explain the concept also. But I want you to have patience because I know how much physics you need and how much physics you don't need. Okay, so just have patience and try and understand. Now I'll ask you a question on this question. Okay. Okay. Now somebody is saying, why not we do CT scan for chronic hemorrhage? But do you understand that any blood clot will liquefy, and after 1 month, any blood clot will become like water? On a CT scan, after a month, any brain hemorrhage will look like CSF because the clot liquefies. You remember, you might have studied in pathology, the clot is taken up by the macrophages and it liquefies. Okay, so blood clot liquefies, and on a CT scan, after a month, it becomes same as CSF. We are unable to differentiate on a CT. Okay, now. Okay, so far I have told you SWI is a special MRI sequence called as susceptibility weighted MRI. Okay, bache? Good for hemosiderin detection in the brain. Chronic bleed. Hemosiderin is chronic bleed. That is what we talked about. Okay. Now, I will now give you one more concept. I will now give you one more concept to understand. T1 weighted image, T2 weighted image. Okay, bache? CSF on T1 weighted image will appear dark. T2 weighted image, it will appear white. Okay, T2 weighted image, it will appear white. Okay, I will repeat, bache. I will repeat when I come to that topic again. I'm just giving you the overall impression. I'll show you the images. Don't worry, bache. Listen to me. Okay. Okay, now see an answer. CSF on MRI appears dark on T1 weighted image, white on T2 weighted image. What about pathology? What about pathology? Okay. What about pathology? Any disease in the body, what will happen? Now listen to me. You might have read about this in pathology. If you have any inflammatory process in the body or any tumor, if surrounding the tumor you have that edema happening, in a inflammation also the capillaries become leaky and that leads to edema. Do you agree? Jahan pe bimari hogi, wahan pe सूजन hogi, and we will call it in technical language as edema. Okay. Okay, everybody understands? Wherever you have a disease, that area will have some edema. सूजन होगा, ये तो हम जानते हैं. We know this from our common sense. Okay. So what do we mean by the word edema? Edema means increased water content. And this is the reason why most of the pathologies are dark on T1 weighted image, white on T2 weighted image. Are you clear? Most of the diseases, when you look at it now, when you go back to your medicine, surgery, ophtha, ENT, most diseases are hyper intense on T2 weighted image, hypo intense on T1 weighted image because of edema. Okay, that is the rationale behind it. That is the logic behind it. Okay, but listen to me and answer. Now, suppose you have a tumor in your body which has a magnetic substance inside like melanin. This rule will not be followed. So when you look at the ocular melanoma in your ophthalmology, you will realize it has an appearance opposite to what we expect on our MRI. Ocular melanomas, because of melanin, which has paramagnetic behavior, it appears hyper intense on T1 weighted image and hypo intense on T2 weighted image. And you will notice now I am also covering the radiology part of your ophthalmic ENT here, that in eye they will definitely tell you that melanoma is a tumor. Remember, choroidal melanoma arises from the choroid layer of your eye. A choroidal melanoma is a unique tumor. On MRI, we can diagnose it because it is hyper intense. It is white on T1 weighted image, dark on T2. Everybody understands the rationale now? The reason is the paramagnetic behavior of melanin. Everybody understands? Everybody follows? Okay. One more thing we need to understand is, now look at the table that I have drawn for you. Okay. Bache, look at the table that I have drawn for you and just tell me, look at the question in front of you and tell me disease or pathology will be easier seen on T1 weighted image or T2 weighted image. Any disease in the brain or for that matter in other body parts, the pathology is easier seen on T2 weighted image, while the normal anatomy is better seen on T1 weighted image. Everybody understands? Because it is easier for us to see white, so disease is easily seen on T2 weighted image, while the normal anatomy is seen on T1 weighted image. In every patient, we will look at both the images, T1 also, T2 also, to understand what we are looking at. One image in itself has no meaning. We have to look at both T1 weighted and T2 weighted in MRI. Okay, so are you clear now? Which MRI sequence is disease specific, which is able to see the disease tissue? T2 weighted image. Now understand and tell me, look at the table and answer, and then we are going to shift to visuals after this. Just look at the table and answer, bache. Okay, everybody look at it. Okay, it's only morning, beta. Don't worry. Look at the table and tell me, bache, what is the drawback of T2 weighted image when I'm looking at a brain disease? T2 weighted image का drawback क्या है जब brain में बीमारी देखनी है? बच्चे बताएं. Okay, anybody? T2 weighted image has a drawback. Listen to me, it has a drawback. Okay, tell me that water is also white, edema is also white. That means पानी भी सफेद दिखेगा, CSF भी सफेद दिखेगा, कहीं सूजन है वो भी सफेद दिखेगा. You understand? T2 weighted image has a drawback that the CSF is also hyperintense. Edema is also hyperintense. Everybody understands? Now suppose we develop a MRI sequence which is able to suppress the CSF signal. Suppose I am able to suppress the CSF signal in MRI. I take a T2 weighted image and I suppress the CSF signal. I make the CSF dark, but the edema still remains white. That MRI technique is called as flare. That MRI sequence is called as flare. What is flare? Fluid attenuated inversion recovery sequence. Okay, so don't rote learn it. There is no point in mugging it up. Only thing we need to do it understand. अगर एक T2 weighted image में inversion recovery नाम की magnetic pulse से CSF को suppress कर दें, that is called as flare. So flare is nothing but a T2 weighted image with dark CSF. And the advantage is obvious that on a T2 weighted image, it becomes even more, on a flare image, it becomes even more easier to see the edema in the diseased area on a flare sequence. दोबारा से बोलो? Okay, दोबारा से बोलते हैं. Are you able to understand the drawback of T2 weighted image was that the CSF is also dark, CSF is also white, edema is also white. तो क्या करें? हमें CSF को और edema में कैसे फर्क करें? So I need to make a MRI sequence जो CSF को suppress करे लेकिन edema को suppress ना करे. That is called as flare. Flare is a T2 weighted image. The full form is fluid attenuated inversion recovery sequence. ये primarily T2 weighted image है जिसमें CSF signal को suppress कर दिया गया. So it is utilizing the magnetic property difference between CSF and water inside the tissue, which is edema. There will be some magnetic field difference between them that is utilized by flare. Okay, everybody understands? Okay. Okay, only melanoma, but I only talked about melanoma. Other tumors will be dark on T1, white on T2. Melanoma was an exception. Everybody understands? Okay, now once we are able to see all this, we are going to now go to the images. Okay, we are now over with the physics parts and we are going to go to the image and I'll talk about more physics with the images. Okay, don't worry. बच्चे देखिए, I will tell you when I show you the T1 weighted image, just I want you to look at the screen and go at my pace. Don't race your mind too fast. Okay, radiology is not an easy discipline to understand at undergraduate level. So please go at my pace. Don't race your mind here and there. Please look at the image that I am now showing you and tell me what body part is this. Okay, बच्चे कौन सा body part है ये? I am so happy to see that most of you are able to tell me. I was thinking you will say abdomen, but this is brain. Very good. This is brain. Okay. Now tell me what section, okay? What section, okay? What section of brain is this? So whenever we talk about sections, listen to me. We talk about sections in the body like this. Transverse section, coronal section, sagittal section. This looks like a transverse section. But in radiology, we do not use the word transverse. Transverse is used by the anatomist. In radiology, we use the word, okay, everybody understand? We use the word axial. Everybody okay with this? Everybody clear? In radiology, wherever in anatomy people will say transverse section, radiology will say axial section of the brain. Because if we don't understand the language of radiology, you will not be able to speak in the same language. So what are we looking at? We are looking at axial section of the brain. Okay. Question number 1. Okay. Question number 1. Is this a CT scan or is this a MRI? Is this a CT scan or is this a MRI? So I want you to look at this area that I'm now labeling for you. That dark area that you see here is your bone. And the white area that you see on the top is the fat in the scalp. So in your scalp tissue, you have fat in your aponeurosis. So you have the fat is appearing white. So if I may ask you, look at the screen and tell me, the bone is appearing dark while the fat is appearing white. That means this must be a MRI image. This is not a CT scan. Okay, bache? So I hope you see that, you people want to become PhD, but I want to make you first MBBS students. That MBBS students in the exam, most common mistake in radiology is कि CT है कि MRI है सर, यही समझ नहीं आया है ना. So don't rush too much. Let me build up. I will go to the level where you will be able to see tumors also. But let us go step by step. Okay, bache? Okay. Now look at the CSF. CSF will be present inside your lateral ventricles. Do you agree? So this is your CSF. CSF. Okay. So inside the lateral ventricle, the CSF is seen. The CSF is appearing dark. Everybody clear? CSF on this MRI image is appearing dark. Okay. Now I want you to appreciate something which is important and it is difficult. Okay, it is difficult. I want your attention here. I want your patience. Okay, I want your patience and I want your attention. But listen to me. In brain, we have gray matter, which is the cortex of the brain, which is gray matter. And below it, we have the white matter. Okay. So in brain, you have the gray matter, you have the white matter. The cortex of the brain is the cell bodies, neuronal bodies, and in the white matter, you have the axons and the tracts. Okay, everybody understands this? Okay, now tell me. Now, white matter is supposed to be myelinated. In an adult, do you know white matter is having axons? Axons are covered with myelin. Should I repeat? White matter is myelinated. Axons are myelinated. Myelin has lipid inside. Do you remember from your biochemistry days? The biochemistry teacher must have talked about sphingolipid. Do you remember the biochemistry teachers talk about sphingolipid? Yes. So you remember white matter is myelin. Myelin has lipid. And that is why on a T1 weighted image, white matter appears more white as compared to gray matter. On a T1 weighted image, because of presence of lipid, the white matter appears more white than gray matter. I will want you to appreciate when I zoom the image. I want you to appreciate. But every year all this is asked in the exam, beta. If you don't understand, you will keep doing it wrong. Okay. So I want you to focus, बच्चे है ना. अभी बात इधर उधर नहीं करेंगे. They will listen to me, बच्चे है ना. बच्चे देखो. So I hope you are now able to see. Compare the cortex of the brain, which is your gray matter, with the white matter. Can you see this white matter is appearing more hyper intense? That is because of your myelin. Myelin has inherent lipid content, which is the logic behind it. So only two things I want you to remember with me are CSF is dark, white matter is white on a T1 weighted image. Okay, CSF appears dark, white matter appears white on a T1 weighted image. But you will not be able to understand till the time I show you the second image. Okay, so that is very, very critical to see the second image. Okay, on a CT scan, the gray-white matter differentiation was not as good as what you see on MR. And that is why you need MRI. बच्चे नहीं तो MRI बनाते ही नहीं ना, है ना? Okay, so now let's see an answer. Okay, बच्चे everybody see with me. Okay, I will show you MS, etc. Bache, don't run. Okay, bache, bhagne nahi hai. Bache, I see some children are running, and that is the problem. If you keep running, you will not be in the present. You are either in the past or in the future. You have to be in the present, bache. That is mindfulness, है ना? जो टीचर बोल रहे हैं वहां पे आना है आपने, उसके आगे या पीछे मत जाइए. अभी सुनिए मैं क्या कह रहा हूँ. Okay, I will show you, bache. Listen to me. This is next is again an axial MRI of the brain. You can see the bone is dark, fat is white. Okay, so I'm sure you are agreed that even in the next image, the bone is dark, the fat is white. Okay, bache? So this is axial MRI. I want you to answer, all the children, what is the color of CSF in this image? Anybody now? What is the color of this image? What is the color of the CSF? CSF कैसा लग रहा है बच्चे आपको? कैसा लग रहा है CSF? बच्चे बताइए. CSF बोलो appears white. CSF in this image is white. Okay. Now listen to me, bache. White matter of our brain. Okay, everybody listen to me. It's very complicated. Even PGs will do this wrong. Okay, listen to me. White matter of your brain is myelinated. When that tissue is myelinated, so myelin has that property to absorb water, and the water content reduces. Okay. Remember, any tissue in your brain, once it is myelinated, the water content reduces. Okay. So on a T2 weighted image, the water containing tissue will appear bright. If any tissue has reduced water content, it will actually be darker. Okay. It's very complicated, but listen to me. CSF on this image is white. This is a T2 weighted image, and the white matter is darker than the gray matter because of reduced water content. So T1 weighted appearance of white matter was because of the lipid content in myelin, but the T2 weighted appearance is governed by the reduced water content in the myelinated tissue. Okay. The only reason all this is looking a little tough to you is because I'm telling you the why behind things. Okay. I'm not just telling you the facts, I'm telling you the reason behind them. Okay. Now I want you to look at it. Okay. I'm labeling it. Okay. I'm labeling it. So you can now see the gray matter and white matter. If you compare them, okay, I'm sure you can. I'm sure you are able to do this. I'm just getting it here. Okay. So are you able to see the gray matter and white matter? When you compare them, the white matter is darker. Okay. In T2 weighted image, the white matter appears darker than gray matter, while on a T1 weighted image, the white matter was more white. Now I will put both the images together so that you can see them together. And every year in an exam called as PGI Chandigarh, this is asked in the question कि भाई white matter बताओ, gray matter बताओ, कैसा लगेगा? So T1 weighted image पे white matter ज़्यादा white होता है, T2 weighted image में gray matter ज़्यादा white होता है. Okay, it's as simple as that. But what happens is most people do it wrong because they never understand it, they never spend time over it. Okay. Yes. So white matter, myelinated tissue, where when the myelin lays down on a tissue, myelin resorbs the water from that area, and that area has less water than a non-myelinated tissue. And that is the reason why on a T2 weighted image, the myelinated white matter actually appears darker than the gray matter. Okay. All we need to know is this much. Now, once you are clear with this, okay, but when you see the image, I will show you the next image. Okay, anybody now can look at the next image and tell me, is this a CT scan or a MRI? Is this a CT scan or a MRI? This is a MRI. Yes. So, Muneta beta, I hope you see the predominant effect is on a T2 weighted image is because of the water. On a T1 weighted, it was because of the lipid. That is why. So one effect is overpowering the other, and that is the reason why this is happening. Okay. Are you clear? Okay. But you now see an answer. Look at the next MRI image and tell me what is the color of CSF in this image. But just forget about whatever you're writing. I just want you to answer and tell me what is the color of CSF in this image. When I look at the CSF in this image, CSF appears dark. Okay, bache? If the CSF is dark, this is your gray matter, this is your white matter. Okay? Just look at the relationship between gray matter and white matter and tell me, do you think white matter is more white here or more dark? What do you think? White matter कैसा लग रहा है आपको? Dark लग रहा है कि white लग रहा है? So when I zoom the image and show it to you, I'm sure most of you are able to see, okay? I'm sure most of you are able to see the white matter in this patient is dark. Okay? So when I look at the white matter, it looks like a T2 weighted image, but the CSF is dark. That means CSF has been suppressed. This is a FLAIR MRI image. Are you able to understand this? Everybody clear that how we differentiate between three different type of images? Okay. So what people are doing wrong is, students, what they are doing wrong is they look at this and they say this is a CT scan and they, everything goes wrong. So what we need to understand is, बेटा आप हमेशा चाहते हैं कि आप पीएचडी कर लें, आप हाईफाई कर लें, असली में पेपर में T1 T2 फ्लेयर सीटी इमेज यही नहीं पता चलता बेटा, है ना? So that is where I always say basics are more important. So only thing I did here was I just look at the CSF and the white matter and I could make a judgment. Are you clear? Everybody? Okay, I can see most of you are able to answer this. Okay, bone beta white नहीं है ना बेटा, देख bone ये वाली है बेटा, you're getting confused. Bone ये वाली है बेटा, ये bone नहीं है, ये fat है, ये हमारी scalp में fat है बेटा जो white दिख रहा है, क्योंकि fat is white on MRI and most people do it wrong in the real exam. Okay, now I will gradually unfold more and more things for you. But before I show you more and more things, I just want you to look at an image and tell me, but everybody look at the image and tell me, what type of MRI section is this? Okay. If I now, okay, बच्चे listen to me. बच्चे अभी बीमारी पे नहीं जाना ना, अभी आएंगे बेटा वहां पे हम, अभी नॉर्मल तो देखा नहीं बेटा, यू वांट टू डू पैथोलॉजी, आई विल शो यू पैथोलॉजी आल्सो बेटा, डोंट वरी, बट फर्स्ट आई वांट यू टू सी नॉर्मल एनाटॉमी बेटा. आई कैन सी सम ऑफ यू वांट टू रन, बच्चे भागना नहीं है, धीरे धीरे मेरे साथ जाएंगे बेटा. ओके, नाउ लुक एट दिस. Now when I change the image, now you will be able to see a sagittal midline section of the brain. Sagittal midline section of the brain. So always remember, MRI has multiplanar capability. MRI has multiplanar capability. The reason is that in MRI, we don't need to move the patient. If I apply a RF pulse like this, I can get an axial image. If I apply a RF pulse like this, I can get a coronal image. If I apply here, I can get a sagittal image. So all that we are doing is we are changing the axis of the radio frequency pulse while obtaining MRI to obtain different planes. Okay, MRI has, better tell me, multiplanar capabilities. Very good. Now I want you to understand the anatomy of the brain. Okay. Let's see if we are able to show you this. Okay, so in my last class, I was trying to show you how the brain looks like, but the internet was not happy at that day. So if you try now, I can actually use a 3D object and show you this is the medial surface of the brain. You can see the cerebellum, you can see the brain stem. Okay, you can see the occipital lobe, the parietal lobe, frontal lobe, and we can see this is the medial section of the brain. Okay, so this is the so this is what I was trying to show you in my last class. And when we look at the lateral surface, you can see the large sylvian fissure that we talked about in the previous class, and we can see the parietal lobe, the occipital lobe. Okay, so this is what I was trying to show you in my last class, but because of the various challenges of lockdown nowadays, I cannot, at night I cannot get the office to be opened, so that is the challenge here. Okay, so I don't want my staff to open the office at night, otherwise I would have gone to the office to take the class. Okay, this is mixed reality today. That is how the technology is possible. Okay, interesting. Okay. So we got an hang on, we got an idea on how MRI and how the actual brain looks like on a sagittal plane. So now, if I now convert that sagittal section that we learned in anatomy, if I show that thing to you on MRI, okay, I want everybody to come back. Okay, I want everybody to come back. Okay, okay, I actually took out my own brain to show you, bache. Okay, now let us come back. Okay, I see all of you are now back and excited. बच्चे अभी सुबह हुई है, सुबह है बच्चे, कोई घबराने की बात नहीं है, relax. Okay. Now what I don't like is, I told you I don't like clock gazers है ना, जो time देखते रहे, I don't like them. Okay, I like people who are motivated all the time है ना. So sagittal image of the brain. We are looking at a sagittal MRI image of the brain. Okay, I will show you. Okay. Now everybody listen to me now. Now this is now your cingulate gyrus. In the midline, remember in the midline on the medial surface of the frontal lobe, you actually have the cingulate gyrus. And below the cingulate gyrus, you have the corpus callosum. To get direct multiplanar imaging on a CT is difficult, but on MRI we can do beautiful multiplanar imaging. You can see the corpus callosum and you can see the cingulate gyrus. Everybody clear? Okay. My question to you is this. Let's see how many of you can answer my question. A chronic alcoholic develops necrosis of corpus callosum. What do you call this disease? So we saw the cingulate gyrus and we saw the corpus callosum, but the question is, a chronic alcoholic develops necrosis of the corpus callosum. What do you call it? Okay, now let us revise. Corpus callosal necrosis. Let's go back again. If you remember, in a chronic alcoholic, if you have thymine deficiency, you develop mammillary body necrosis, that is Wernicke's encephalopathy. But if you have corpus callosal necrosis in an alcoholic, we call it Marchi-Fava. This is the name of an Italian pathologist, Marchi-Fava and his friend Bignami. So we say Marchi-Fava-Bignami syndrome. Okay, everybody clear? Marchi-Fava-Bignami syndrome is necrosis of corpus callosum that you see in chronic alcoholics. Brilliant. And I'm sure you are able to identify the, yes, beta, very good. I'm sure you are able to identify the corpus callosum on the image. So once you are able to identify the corpus callosum, I've shown you a little bit of the applied anatomy here by talking about Marchi-Fava-Bignami syndrome. My question is, what structure is this? What structure do we see below corpus callosum on a midline sagittal image like this? Okay, I will zoom the image for you. Okay, so what structure is marked in green for you? Okay, I will mark a structure. You need to tell me the name of that structure. So below the corpus callosum, when you look at the sagittal plane, we are able to see a white matter bundle which has both commissural as well as projection fibers, which is called as the fornix. That structure is called as the fornix. And fornix is one structure that AIIMS people are very fond of, very, very fond of. Sometimes they will ask you in the image to identify the structure marked. The structure is the fornix on the sagittal section. Sometimes they will ask you what is fornix. It's a white matter bundle. What kind of fibers are there? It has both commissural as well as projection fibers inside. This is fornix for you. Okay, this is how you identify fornix on a sagittal image. Now, when we look beyond the fornix, we can see this is your thalamus, and below the thalamus, you have the hypothalamus. Below the thalamus, you have the hypothalamus. Okay, so we have T is thalamus, and below it, you have the hypothalamus. Okay, but behind the thalamus, so thalamus, below the thalamus, you have the hypothalamus. But behind the thalamus, we have something called as the epithalamus. Are you aware of it? Behind the thalamus, you have a derivative of diencephalon called as epithalamus. And epithalamus contributes to this structure here, which I am sure most of you know. The cigar-shaped structure is called as pineal gland. Okay, this is your pineal gland. So remember now, pineal is a part of epithalamus. So you see thalamus, below the thalamus you see hypothalamus, behind it you see the pineal gland. Everybody understands? So pineal is a posterior part of the diencephalon. So it is of the posterior part of your diencephalon, or the third ventricle is formed by the pineal gland. Everybody understands? Okay. Fornix, I just said, fornix has both commissural and projection fibers. Okay, very good. Now listen to me and answer. So we saw the thalamus, we saw the hypothalamus, we saw the pineal gland. Very good. Now see, I will gradually come to pituitary also, but you don't worry. This area is called as the midbrain, pons, medulla. This is your cerebellar vermis. And between the pons and the medulla and the cerebellar vermis, you have a ventricle called as fourth ventricle. Okay, everybody understands? So the arrow was at the pineal gland, bache. I just showed you this is the pineal gland. Okay, pineal. Okay, so then I will, the black arrow, I will come back to that later. But bhagna hai na, bache, bhagna thodi hai na. Listen to me first. Some people are always running to other structures. जो दिखा रहा हूं बेटा पहले वो देखो बच्चे. Okay, okay. नहीं तो कान पकड़ने पड़ेंगे बच्चे. Okay, जो मैं बोल रहा हूं वो देखिए. So midbrain is above pons, then you have medulla. Behind it you have the vermis. Between the vermis and the pons you have the fourth ventricle. Everybody okay? Okay, very good. Now please see an answer. The lowermost part of the cerebellum is not vermis. Actually, the lowermost part is called as the tonsil. So you can see the lowermost part here, I have labeled it as tonsil, which is sitting right next to the foramen magnum. So just above the foramen magnum, you have your tonsil. Cerebellar tonsil is the lowermost part of the cerebellum. It is just above the foramen magnum. Everybody clear? Yes. Yes, bache. Epithalamus derivative is pineal. Yes. I will gradually show you the commissures also, bache. Don't worry. But let's see if you can answer a question. Okay. Let's see how many of you can answer a question. Okay. I'm going to give you an ophthalmology question to solve. A 12-year-old boy comes to you with upward gaze palsy. His MRI shows a mass in the posterior part of the third ventricle. His beta HCG level in CSF are raised. His beta HCG level in CSF are raised. What tumor are we looking at? Okay. Everybody now try and solve the question now. This is an integrated question. Now what happens is, this looks like a radiology question, ophthalmology question, but actually it will depend on your knowledge of your anatomy. Okay. Any one of you wants to make answer here? Okay. Wants to give an answer here? Anybody now? Now let's see. This patient, if you have, now I just told you, the third ventricle is the cavity of the diencephalon, posterior to third ventricle, you should have the pineal. So if you have a mass in the pineal, if I have a tumor in the pineal, if this is the pineal and this is a tumor, please notice right next to it, you have the dorsal part of the midbrain, which has the colliculi. So these are your superior colliculi, inferior colliculi. Right next to your pineal, you have the colliculi. So now I want you to guess as children, if you have a pineal tumor, it will compress the superior colliculi. This is called as, and it will lead to superior colliculi required for upward gaze. So this is called as the Perinod syndrome. Or we will say dorsal midbrain syndrome, Perinod syndrome. So there is a pineal tumor leading to Perinod syndrome due to compression of dorsal part of midbrain due to compression of the superior colliculus. But why is the beta HCG high? Beta HCG is high because pineal area can have germ cell tumors. So the pineal germ cell tumor is called as germinoma. Okay, pineal region germinoma is the answer to the question. So this is a classic example of an integrated question. You cannot solve it by your ophthal or anatomy or pathology. You need to put them all together. बच्चा है लेकिन उसको upward gaze palsy है और posterior part of the third ventricle में tumor है. Posterior part में तो pineal होता है. Pineal tumor में तो midbrain का dorsal part compress होगा जिसको Perinod syndrome कहते हैं. लेकिन फिर बीटा HCG क्यों बढ़ा हुआ है? क्योंकि germ cell origin है. So answer is pineal region germinoma. Everybody understands how we deal with such questions? So this is an integrated example of an ophthalmology question where the basis lies in our brain anatomy. Pineal is closely related to the dorsal part of the midbrain. So when there is a pineal tumor, the dorsal part of the midbrain compresses, especially the superior colliculi. Should I repeat, children, or are you able to understand? Okay, I can see most of you are able to follow my point. Perinod syndrome is also called as the dorsal midbrain syndrome. ठीक है बेटा, कोई भी बीमारी dorsal midbrain को affect करेगी तो upward gaze palsy होगी. And pineal is located near the dorsal part of the midbrain. It is located near the colliculi और उनके compression के कारण यहाँ पे upward gaze palsy है. Pineal में germ cell tumor होता है जिसका नाम है germinoma, जिससे beta HCG बढ़ गया. Okay. I can see most. I have actually repeated it twice and thrice. Now I'm coming back, Bache. I'm coming back. Okay. So have you written it down? Yes. So this is how the questions are framed at top level. Bache, देखिए, we have to understand when we are studying, we are reading from basic. I'm telling you the difference between how to look at a CT image and MRI image, but I also want you to top the exam. So I'm showing you how the questions at the topmost level will appear and how the bottommost questions will be there. Okay. I will repeat tonsil also, bache, later on. Just listen to me, bache. Listen to me. Above your superior colliculi, near the pineal, you have a commissure here, which is called as the posterior commissure. Okay, some children were getting a little restless about posterior commissure, so I thought I will tell them. So posterior commissure is closely related to the pineal and the dorsal part of the midbrain. Everybody understands? Yes, beta. Okay. Now, so bache, I see some of you are asking questions which you should not be asking, bache. If you remember, midbrain has two parts. The anterior part is the tegmentum. The posterior part, the dorsal part, is the tectum, which contributes to the superior colliculi and inferior. So they are actually part of midbrain itself. They are called as the tectum, derivative of tectum. Okay. 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 Very good, bache. Very good, bache. Now please see an answer. Through the midbrain. Okay. Now I want you to see with me through the midbrain. Can you see a thin CSF duct passing by? Through the midbrain, a thin duct of water is passing by. That is called as the aqueduct of Sylvius. Okay. This aqueduct of Sylvius connects the third ventricle to the fourth ventricle. So this is where you have your fourth ventricle. Through the midbrain, you have a thin CSF duct, which is very, very thin part of the CS ventricular system. This is your aqueduct of Sylvius. So through your tectum in the midbrain, you have the aqueduct of Sylvius passing by. Do you remember all this? Yes. Okay. And from the fourth ventricle, the CSF has to come out of the fourth ventricle via CSF will come out of the fourth ventricle via a midline foramina called as foramina of Magendie. Okay, and there will be two lateral foramina which we cannot see in this section because this is in the midline. This section is a midline section. On laterally, you will have two foramina of Lashka. Do you remember this or not? Or are you hearing all this for the first time, बच्चे? फोर्थ वेंट्रिकल से दो फोरामेन ऑफ लुश्का निकलेंगे, एक मेजेंडी निकलेगा. सो दिस इज द फोरामेन ऑफ मेजेंडी दैट यू आर लुकिंग एट. ओके, आर यू क्लियर? दिस इज द, सो नाउ यू कैन यू सी एक्वेडक्ट ऑफ सिल्वियस से सीएसएफ फोर्थ वेंट्रिकल में आ रहा है, फोर्थ से वो फोरामेन ऑफ मेजेंडी में जा रहा है. Foramen of Magendie say the CSF goes into this CSF space here, which is called as cisterna magna. Which is called as cisterna magna. Are you able to understand now that the CSF from fourth ventricle via the foramen of Magendie goes into a cistern behind the medulla, which is called as the cisterna magna. Everybody clear? Everybody remembers? Yes. So once you are able to remember all this, I will now remove the anatomy that we are looking at and I will ask you a question. Okay. Now, behind the fourth ventricle, we have the cerebellar vermis. If this is your cerebellar vermis, what structure is this? Can you see a membrane or a curtain-like structure? Curtain मतलब पर्दा, पर्दे के जैसा curtain-like structure which is covering the superior part of your fourth ventricle. पीछे से fourth ventricle को एक curtain cover कर रहा है. That curtain is called as, anybody knows? Superior medullary vellum. Okay, that curtain is called as superior medullary vellum. Okay, do you remember this? Now, my question to you is this. Now, I will not tell you anything which has no clinical relevance. I will always tell you things with clinical relevance. Name a brain tumor which arises from cerebellar vermis and superior medullary vellum. Name a tumor of the brain which arises in the area of the superior medullary vellum. Anybody? Okay. Okay. Everything is actually given in all of your bache hai na? Okay. Okay. Anybody now tell me, name a brain tumor which arises from superior medullary vellum. This is pathology. This is not to do anything with radiology. And the brain tumor which arises from superior medullary vellum is called as medulloblastoma. Did you read about medulloblastoma in your second prof? Maybe. So, but you know, I hope you see, some of you are getting afraid and they're getting afraid of tough things. बच्चे मुश्किल से भागना थोड़ी है. So I always say, बच्चे देखो, whenever I tell you anything new, whenever I teach you something new, do you feel happy as a child? Or do you feel angry as an old man? बोलो बच्चे. Whenever I teach you something new, do you feel happy as a child? You know, remember school में जब मैडम ने पहली बार बताया था अंटार्कटिका होता है, you were so excited. So today when I teach you something new, are you happy as a child or are you angry as an old man? You should always be happy as a child. And more happy as a child you are about learning, better your learning abilities will become, and you will never age. Okay, so you have to be happy to learn something new. Don't write on the chat box ke sir zyada hai kam hai bache aisa thodi. So you have to listen to me and follow me whatever I'm teaching. Okay, so whenever you learn something new, learn to be happy about it. Okay, not everybody gets to know everything in about the human body. We are the lucky few that know. So let's spend time. Okay, everybody now clear? Okay, second question. Second question based on this anatomy that I've told you is, this area is your vermis. Name a congenital condition in which the vermis is not formed. Agenesis of vermis, and you have a posterior fossa cyst in this location. Okay, anybody can guess. Name a condition in which, बच्चे सोचो और बताओ, name a condition, एक ऐसा बताओ जिसमें वर्मिस बना नहीं जन्म से, एजेनेसिस और पोस्टीरियर फोसा में सिस्ट है. Okay, what should I call it? So if vermis is not there, we will call it Dandy Walker syndrome. Okay, so this is what we miss in our anatomy and embryology classes, and in exams they will keep asking all this. Name a condition in which the vermis is absent, and instead of the vermis you have a cystic space or a CSF space there. We call posterior fossa cyst. We call it Dandy Walker malformation. Please do not write Johnny Walker at this hour. Okay, I am saying Dandy Walker, bache. Okay, everybody clear? Okay, so once you're clear. Yes, बच्चे, medulloblastima had nothing to do with the medulla. See, surprise, है ना? बच्चे देखो एक और सीखेंगे. So the lowermost part of the cerebellum, which is sitting right next to your foramen magnum, is the tonsil. Okay. Lowermost part of the cerebellum is tonsil. Okay. Name a condition in which you have a small posterior fossa. Posterior मतलब पीछे का area. So name a condition जहां skull का पीछे का area birth से छोटा है. Okay. So now understand and look at it and answer. If your posterior fossa is small, the structure which is, listen to me, if a structure which is sitting right next to the foramen magnum, it will herniate. Do you understand? अगर स्कल का पीछे का हिस्सा छोटा होगा तो जो सबसे नीचे बैठा है वो स्पाइनल कैनाल में हर्निएट कर जाएगा. सबसे नीचे था टॉन्सिल. So my question to you is, name a condition in which you have a congenitally small posterior fossa and tonsillar herniation. Anybody? So this condition is called as type 1 malformation. And you must be seeing all these questions since your first prof. I want you to know the salient lines here. So if you have small posterior fossa, tonsillar herniation, you will call it Chiari type 1 malformation. If along with these two, you also have spina bifida, which is written as mylomeningocele. Okay. If along with small posterior fossa and tonsillar herniation, even if you also have spina bifida, mylomeningocele, we will call it Chiari type 2, which was described by Dr. Arnold. So we call it Arnold-Chiari malformation. Okay. Okay, actually I'm speaking everything in English only. In between, only thing I repeat it in Hindi, but I never speak it in one language. Okay, I always repeat it in English, beta. Okay, small posterior fossa, beta. Understand? With tonsillar herniation, we'll call it Chiari type 1. If you also have myelomeningocele, then you will call it Chiari type 2, or you will use a word Arnold-Chiari malformation. Now, my question to you is this. Which type of Chiari malformation will not be diagnosed at birth? Which type of Chiari malformation will not be diagnosed at birth? The answer is Chiari type 1. Chiari type 1 is usually diagnosed in second decade of life because of development of syringomyelia. Everybody clear? Everybody clear? Chiari type 1 is not diagnosed at birth. It is diagnosed at second decade of life due to development of syringomyelia. Arnold-Chiari malformation, on the other hand, is diagnosed antenatally. On an antenatal ultrasound itself, we are able to diagnose Arnold-Chiari malformation. The signs that we see here are, we see a lemon-shaped deformity of the skull and a banana-shaped deformity of the cerebellum. You will read these two words repeatedly in your OBS classes also. Lemon skull, banana sign. These are indicative of spina bifida. Now we are supposed to diagnose Arnold-Chiari malformation on antenatal ultrasound so that the parents can decide if they want to continue with the pregnancy or not, because spina bifida is a spinal deformity and there might be some, he may have paraparesis because of this. So it is important to diagnose all this. But are you able to see the difference now? Okay. Each one of them has been asked in a previous NEET exam. Okay. So listen to me and answer very carefully. If they only write small posterior fossa tonsil herniation, I want you to write Chiari 1. If they also say myelomeningocele, I want you to say Chiari 2. Chiari 2 will be diagnosed in antenatal ultrasound due to lemon-shaped skull, banana-shaped cerebellum. Chiari type 1 will present in second decade of life due to development of syringomyelia. Mylia matlab, बच्चे mylia matlab cord, syrinx matlab cavity. Okay, so this is the importance of the tonsil that you were asking me. Okay, so I will now quickly revise the anatomy that we have seen so far. We saw the cingulate gyrus. We saw the corpus callosum, the genu, the body, the splenium. We saw the fornix, thalamus, hypothalamus, pineal, midbrain, pons, medulla, vermis, tonsil. 420. Okay. Okay, everybody understands? So what I'm trying to do is, actually I'm trying to revise your cross-sectional anatomy that you learn in anatomy in a applied fashion. I'm in between showing you some applied anatomy as well, so that we are able to understand the why behind it. Okay, why do we need to know all this is the key. Now I want you to look at the midbrain. Anterior to the midbrain, I want you to look at the structure here. Anterior to the midbrain, we have a structure called as mammillary body. Anterior to the midbrain, we have a structure called as mammillary bodies. And is any one of you able to answer this? Name a disease in which you have damage to the mammillary bodies. Wernicke's encephalopathy. Remember the thiamine deficiency part? Yes? Okay. Okay. And हाँ जी, I'm back. It's just the internet today is not working fine. Okay, so I think you'll be back. Okay, I hope we are back. Okay, okay. So once you are all back, okay, beta, we are all back. Okay, okay, okay. So this is where we were. Okay. So I've just logged on to my phone internet for the time being, and I'll shift to the internet once it comes back again. Please see with me. So anterior to the mammillary body, you have a flat area of hypothalamus called as tuber cinereum. Okay. Anterior to the tuber cinereum, we have optic chiasma. Okay. Anterior to the tuber cinereum, we have optic chiasm. Okay. Now, between the hypothalamus and the pituitary gland, you have a stalk here. This stalk is called as the infundibulum. This stalk is called as the infundibulum. Are you clear with this or not? Should I repeat? Okay. So from posterior to anterior, this is how the anatomy is. सबसे पीछे मेम्बुलरी बॉडी है, उसके आगे ट्यूबस सिनेरियम है, फिर इनफंडिबुलम है, उसके आगे ऑप्टिक chiasm है, उसके आगे we have the optic chiasm. Okay. Below it, you can see the pituitary gland. Below it, you can see the pituitary gland. Now, pituitary gland has two parts. Okay. Okay. Pituitary gland has two parts. It has an anterior part and a posterior part. Okay. Tuberous cinereum बच्चे आपने anatomy में पढ़ा होगा. Hypothalamus का lower most part दिख रहा है जो उसको tuberous cinereum कहते हैं. Now let's understand the concepts here. Okay. I'll show you the applied anatomy here. So pituitary has an anterior part and a posterior part. So if you appreciate it here on the image that I'm zooming, the posterior part of the pituitary is appearing brighter. The posterior part of the pituitary appears brighter. Okay. So what I'm saying here is posterior pituitary on MRI appears as a bright spot. Why? Because of vasopressin, because of presence of vasopressin, which is also called as ADH. Now, vasopressin has paramagnetic behavior, and that is the reason for this appearance. Okay, yes, you should write whatever I am writing down, you are supposed to write down, bache. Okay, Shinchan, happy birthday, beta. Okay, now see, so posterior pituitary, beta, beti, whatever. Okay, so posterior pituitary on MRI appears as a bright spot due to presence of vasopressin, which has paramagnetic behavior. Now, can you guess an answer? Beta, can you answer and tell me, okay, beta, tell me, in which condition do you think the posterior pituitary or pituitary bright spot will be absent? In which condition do you think this pituitary bright spot will be absent? The answer is central diabetes insipidus. Central diabetes insipidus will have absence of this pituitary bright spot. Okay, so this is the applied anatomy of this part. This is the applied anatomy that we are supposed to know. Everybody clear? Yes, I can see most of you are able to understand. So this is what you will learn when you're reading endocrine and diabetes insipidus, etc. But once we know it from radiology, it makes it easy to correlate. Now, some of you were getting confused by an area of the brain called as tuber cinereum. Tuber cinereum is a part of hypothalamus. Okay. Tuber cinereum is a part of, okay, hypothalamus, and this is the area of the brain through which hypothalamic hamartoma arises. So remember, tuber cinereum is the area of the brain. Shinchan, if you can change, if you can tell us your real name also, we can wish you also, beta Shinchan. Okay. We will not go home before we celebrate Shinchan's birthday. Okay. Please now stop asking for me to go. Okay. But Shinchan, please change your name to the true name if you want to really be wished by all of us. Tuber cinereum, everybody remember, is the site of the hypothalamus from which hypothalamic hamartoma arises. And this is what you will read when you read about precocious puberty in pediatrics and obs-gynae, and a special type of seizure called as gelastic seizure in medicine. Hypothalamic hamartomas are tumors which are associated with, okay, Darshan Agarwal, I think somebody said Darshan. Okay, happy birthday, Darshan. Some boys are actually thinking of girl, but it turns out to be Darshan. Okay. Okay. So tuber cinereum is the site of hypothalamic hamartoma associated with precocious puberty and gelastic seizure. Gelastic seizure means bouts of laughter. Gelastic seizure is a Greek term which means bouts of laughter. So now this child will be having excessive bouts of laughter. Okay. Just like I see some of you now developing gelastic seizure because of Shinchan's birthday. But keep it in mind, it is very important question for your exams. Which brain tumor is seen in a child with excessive bouts of laughter? The answer is hypothalamic hamartoma, arises from tuber cinereum. What else can the child have? Precocious puberty. Okay, everybody clear? Okay. Now, before we are actually reaching to the end of this image, and just one more image to show after this, nothing more after that, is this. I want you to see this area below this pituitary gland is your sphenoid sinus. This is your nose, nasopharynx, and the bone that you see here is called as clivus. Okay. Okay, there are two birthdays today. Shinchan, happy birthday. Darshan, happy birthday. Okay, we have two children who are celebrating their birthday tonight. Okay, so please send me the cake later on. Please see now, everybody. So behind your nasopharynx, you have a bone which is formed by the basisphenoid and the basioccipit is called as clivus. Okay, this bone is called as clivus. Now suppose if you have a notochord remnant tumor developing in the clivus, okay, suppose you have a notochord remnant tumor developing in the clivus of a patient, which doctor will be able to see this tumor? Anybody? Which doctor will diagnose this tumor? If you have a notochord remnant tumor developing in clivus, which doctor will diagnose this? Anybody? Anybody? So that doctor will be a ENT surgeon. Because in ENT, you will read, when you go through the nose, behind the nose, you have the nasopharynx. And a notochord remnant tumor arising from the clivus will actually be diagnosed by an ENT surgeon as a nasopharyngeal mass. What tumor am I describing? This tumor is called as chordoma. So this is the reason why. This is the reason why when you see in ENT, they will tell you as a differential diagnosis in a nasopharyngeal tumor, you also have chordoma. And chordomas are on pathology, they show notochord cells, which are called as physalliferous cells on microscopy. So sometimes they give integrated questions like this, and they say, okay, they say a patient with nasopharyngeal mass shows physalliferous cells on microscopy. What tumor are we dealing with? The answer is chordoma. Chordoma arises from, it's a notochord remnant tumor. But sometimes you may not be able to see, sometimes you may not be able to imagine that why a clivus tumor is going into the nasopharynx. So for the children who could not understand, this is where you have the clivus. Clivus is anterior to the foramen magnum. It is formed, it is a synchondrosis between the basi-sphenoid and basi-occipit. It is formed by sphenoid and occipital bone together. If you have by mistake the remnant of the notochord tissue here, it can give rise to a chordoma, and chordoma presents as a nasopharyngeal mass to the ENT surgeon. If it goes posteriorly, it will also involve the cranial nerves here. Okay. Remember, at the pontomedullary junction, you have cranial nerves, so it can involve the cranial nerves, it can cause nasopharyngeal tumor, and the key is biopsy. On microscopy, you can see a characteristic feature called as physalliferous cells. Everybody clear? Everybody clear? Okay. So this is the the applied anatomy of this section that we studied together. Now what I'll do is I'll show you a little bit of what you have learned in anatomy. Okay. Just before we close the class today, I'll just show you what we have learned in anatomy. This is a 3D diagram of your ventricular system. In your ventricular system, I'm sure now you can follow. This was the lateral ventricle. It has the anterior horn, posterior horn, inferior horn. Do you remember in my last class? I showed you, okay, that there is an anterior horn of lateral ventricle, posterior horn, inferior horn. Inferior horn was in the temporal lobe, okay. And then I showed you that these are the foramen of Monro. This is your third ventricle. This is your fourth ventricle. And remember, this was the foramen of Magendie. This was the foramen of Luschka. Okay, everybody understands? Okay. Now my question is only one, and once you answer this question, I will be able to close the class for the day. Okay. Once you answer this question, I will be able to close the class for the day. Bacho, name a structure in the brain which is located postero-inferior to the inferior horn of the lateral ventricle. Okay. ऐसा कौन सा स्ट्रक्चर है ब्रेन में जो लैटरल वेंट्रिकल के इंफीरियर हॉर्न के नीचे है और पीछे है? So we say name a structure in the brain which is located postero-inferior to the inferior horn of the lateral ventricle. Anybody? So this is the location of your hippocampus. Remember? So that pink colored structure that I've drawn here is your hippocampus. Hippocampus is obliquely placed in your brain like this. Okay? Now, let's see, any of you can answer my question, because I know some bachas are, want to sleep, but just to finish off, because otherwise this point will be left. If I take a section like this, what section is this? Coronal. Okay. And if I take a section like this, what section is this? This is oblique coronal. Okay. Now, the question is, very good, but I can see, some people have the doubt on why clivus was white. I will explain in my next class. But don't worry. Okay, I'll explain it tomorrow. But answer this question first. Hippocampus is best seen on a coronal section of the brain or oblique coronal plane? Anybody can now guess. So the answer is actually oblique coronal. Why? Because it is located like this. If you cut it perpendicular to the hippocampus, then only you can see the hippocampus well. And that is why they will keep giving this question multiple times in your exam. In patients with suspected Alzheimer's dementia or temporal lobe epilepsy, which is written as mesial temporal sclerosis, what section of the brain do? We do anybody? We do a oblique coronal section. Okay, because in both the diseases, we want to see the volume of the hippocampus. We want to see the volume of the hippocampus in Alzheimer's. We want to see the volume of the hippocampus in temporal lobe epilepsy, which is also written as mesial temporal sclerosis. You might have studied of this, or you will study later. Have you ever heard of something called as complex partial seizures? Okay, so you will read about this in your pediatrics and neurology. Complex partial seizures are associated with the atrophy or damage to the hippocampus. We call this as temporal lobe epilepsy, or we'll say mesial temporal sclerosis. Both of them are best seen on oblique coronal scale, not on a routine coronal MRI. Okay. Now, just to give you an idea how it looks like. Okay, you cannot identify it on one plane. Just to make sure that you are understanding, I am showing it to you. This is a routine coronal T2 weighted image of the brain. This is a routine coronal T2 weighted image of the brain, while this is a oblique coronal image, and the red mark structure here is actually the hippocampus. So these are the temporal lobes. Hippocampus is present medial to the temporal lobe. It is in the mesial part below the inferior horn. So hippocampus is present below the inferior horn of the lateral ventricle, and this is how the hippocampus looks like on a coronal plane. Are you clear? Everybody understands? But what you read in anatomy is this. So this is how in anatomy they will show you hippocampus. Okay, this is the hippocampus, while it looks like a seahorse. Okay, so anatomy diagram will be slightly different from what we are looking at. Everybody understands? So are you a complex partial seizure? I said, bache, but I hope you are able to now see that why anatomy of the brain is little difficult to understand on the cross-sectional anatomy. So I tried my best to give you the idea on different sections of the brain. Now, before we close the class today, I just want to remind you of the mindset required for winners. The mindset of the winners is they are always happy to learn new things. Okay, this is the message that I want you to go home and sleep tight with this. Remember, happy to learn new things is the key. Most people, after a certain age, they stop learning and they start getting angry. Remember, and if you continue to learn lifelong, you will always be happy because you are happy to learn new things. Otherwise, the world will change very fast. अब तब इंस्टाग्राम नहीं होगा, तब कुछ और आ रहा होगा बेटा, अपना ऑगमेंटेड रियलिटी वाली चीज चल रही होगी, उसमें कैसे करेंगे, है ना? So we need to constantly learn new things, and in medicine you will always have new things to learn. I want you to be happy to learn new things. Please don't be angry when I teach you something new, है ना? गुस्सा करेंगे तो बात नहीं बनेगी. We need to be happy to learn. Thank you very much. Okay, thank you very much. See you tomorrow again. कल फिर दोबारा we will do the midnight session. and we will look at more MRIs, and I'll answer a lot of your queries also that you have asked, because a lot of your queries will come in due course when I'm teaching. They will keep solving. Okay, so wish you all the best. Take care of yourself. Good night.